constantly juggling a lot, going through a lot of things in the life. If you're someone who engages in any kind of, maybe say a substance like alcohol use, you can also be able to assess yourself. So we want to start off this conversation from a place of awareness, right? So, because for most mental health conversations, we usually say we start from the known to the unknown. So as an individual, right, as you're sitting there this morning having this conversation with us, let us do a wellness check, right? Let us do a check-in with ourselves and just find out how are we doing, where are we at psychologically. So if you go to the chat box one more time, you'll be able to access that link where you can assess yourself for common mental health conditions, anxiety, depression, burnout, substance use, and even if you're someone who's ever experienced a traumatic situation, you can also assess yourself for any possibilities or symptoms of PTSD, right? So as you go through the assessments, it's very important for me to emphasize that this is not a diagnosis, right? So depending on the outcome of that assessments more or less are just like eye openers. We use them as psycho-educational tools in which we can be able to find out how are we feeling. So as you go through the assessment, the goal is that as you answer the questionnaire, are you able to see or identify any symptoms within yourself? Are you able to give words to most of the things that you are feeling, right? So if any questions or concerns emerge as a result of those assessments, you are free to ask, and let us make the chat box as interactive as possible. So I'll just go on straight. So as in the scope of my conversation, I'll just first of all be talking about what mental health is, because we need to have at least a basic understanding or a working definition of what mental health is, or what mental health looks like. I'll also be looking at what are some of these unique aspects, right? What are these emerging issues that maybe might be specifically, right, might increase the prevalence of mental health difficulties for people in institutions of higher learning or higher education. And then also be looking at, as an individual, what can we do to foster our wellness, right? Because remember, our wellness is not something that we want to delegate to other people, right? We want to be proactive rather than reactive to our wellness issues. And then as institutions, right, as an institution of higher learning, what is it that you can also put in place to ensure that your staff, your employees, and especially the students who you are providing services for have access to mental health conditions. So that's just the scope of this conversation that I'm hoping to have this morning. Right. So like I mentioned, I'm from Chiromo Hospital. This is a specialist psychiatric hospital. It's purely a mental health facility. And as I'm having this conversation today with you, I am seated at the Upper Hill Medical Center branch. This is our only outpatient branch where I will be facilitating the talk from today. Right. So just so straight into it, as we are looking at mental health, specifically in the institution of higher learning, but as a whole in the country, right, the statistics are telling us at the moment that 1 in 4 people, right, have experienced a common mental health condition. So it means 1 in 4 people have ever gone through or experienced something like anxiety, which is fairly common, depressive illnesses. Some people might have difficulty with substance use or regulation. So these are some of the most common mental health conditions just in general in the public, right? And even we do know that even for people who actually go to hospitals or healthcare facilities to get regular medical treatment for physical conditions, most of them actually also still have some elements of mental health difficulties that sometimes come out as physical complications. So as we are looking after our physical health, we also want to look after our mental health. So questions to my participants today who are joining me: how are you taking care of yourself? What is it that you're doing at the moment to take care of yourself? So we are not talking about our ideal self. We're not talking about things that I feel like might be helpful to me. We are doing an assessment of at the moment as we are having this conversation today on the 12th of March, right? What exactly are you doing to take care of either your physical or your mental health? If you have an answer for that, maybe you can share with us. If you are unable to pinpoint any intentional or proactive steps or activity that we have taken deliberately to take care of our mental health, then that points to the fact that we need to be more intentional, right? Remember, our mind is what houses our ability to move, to be productive and everything. And especially in a learning environment, right? If you have difficulties with any mental health conditions, then your ability to be able to be productive in the workplace, if you're a staff member, to actually be able to concentrate to do your best and deliver on your duties, and even expectations as a student will be affected. Conditions like anxiety, which are very, very common, might even affect your ability to undertake examinations, meet the objectives of the school, right? And even sit in an examination room. So that's how common some of these mental health conditions can affect us, right? And remember, from the link that I just shared, you can assess yourself for anxiety disorders and depressive illness, which are very common, just to find out how have I been feeling over the last few days. And maybe as I go through the talk, I'll just be pointing out what exactly is a depressive illness, right? What exactly is anxiety? Because anxiety is normal. Anxiety is what makes us take caution. Anxiety is what keeps us alive. When I'm crossing the road, then I check left, right, then I decide I should just use a footbridge, right? It's that sense of caution. But this sense of caution sometimes can be disordered. And that's at the point where now anxiety becomes a problem. If you're maybe a staff, you might have difficulty standing in front of the classroom, delivering on the work that you should. If you're a student, you might have difficulties expressing yourself. You have a class presentation, you'd rather miss class than actually go through or be around such an anxiety-inducing situation, right? And so if you're in an environment that is high pressure, right, both from the environment and sometimes internally because of our need to excel and meet personal goals and ambitions, right? These high pressure situations coupled together with financial difficulties, because for most people who are actively in institution of higher learning, they're most or less just they're focusing on building, right, a future for themselves. So most of them are not really engaging in activities that offer financial assistance or reward. And sometimes this can now reflect back onto their inability or difficulties with meeting everyday financial requirements, even things to do with school fees or even personal upkeep and things like that. And then lastly is personal challenges, right? What personal concerns are we walking into these institutions with, right? Do I have any difficulties with impulse control? Do I have any personality traits that could make it very difficult for me to adjust and cope in a learning institution? So what some of the difficulty that we could experience as a result of mental health in these institutions, they vary and they cut across. So just for this purpose of this conversation, or just a working understanding of what wellness, and especially mental health and wellness is. Remember, I just asked a question before. What exactly are you doing intentionally for your mental health and wellness? What exactly are you doing? Because wellness, these are practices or habits that we engage in primarily for our own health, right? If you take part in anything specifically to prevent an illness, to put your body in a position where it can actually tackle everyday difficulties, then you are engaging in wellness. Wellness is an active process. It is ongoing. It's not something that we can achieve and then plateau, right? We constantly have to keep on doing it. So at the beginning, if you're not very intentional, it could be a period of trial and error. What exactly works for me? If I want to engage in physical exercise, am I going to the gym? Am I someone who prefers to go for a run? Cycling, would a walk do it for me? Am I going to jog? Am I going to play a 20-minute video and follow along to it? So in the process of finding out what actually works best for you, what fits your process is a process of trial and error. It's what we call finding your baseline. A baseline is gotten from a time when you would say things were relatively good, right? I was comfortable with myself. I was comfortable in the workplace. I was comfortable with my studies, showing up for class, doing my assignments. My sleep was good. My appetite and food intake was very good. My social life was pretty much comfortable. So that is your baseline, right? So baseline is from a time when you would say you were relatively comfortable with different aspects in our life. So when a difficulty comes in, most times two things are likely to happen. There are things that we will do in excess, and then others we might do less of. Example of a reduction will be withdrawal and social isolation. We do know that one of the ways people respond when they're having difficulties is to withdraw and isolate for long periods of time, right? So that's a reduction in social activity or interaction. Other excesses could be excessive substance use, sleeping for long periods of time, right? Excessive feeding as a way of emotional feeding in response to stress and difficulties. So this is now what our wellness looks like or means. When you actively take part in practices that are meant to attain good health outcomes, and you're constantly pursuing them continuously, right? That is what wellness is. Now, mental wellness, on the other hand, is just one of the aspects of wellness, because in wellness, we want to be as holistic as possible, right? There's social, there's spiritual well-being, there's emotional health, and wellness. There is a career wellness, right? Even financial wellness also. All these parts, which we say they're the 8 dynamic or the 8 dimensions of wellness. So you might be doing something for your physical health. You might be doing something for occupational growth, right? You are at work, working, or you're at school, hoping to have a career and start off things in the future. But then what are you doing for your spiritual wellness? When is the last time you focus on your spiritual wellness? Because even despite having different religious beliefs, wellness, spirituality is a constant for each and every person, right? Spirituality are the things that keep you grounded and give you a sense of meaning. So our specific discussion today is on mental health and wellness. Okay? So when you look at mental health or mental wellness, one of the things you use to define it, first of all, is our ability to cope with stressors. So think about it. When you meet a stressor, when you meet a difficulty, what is the first thing that you do? What's your first response like? Right. And then to that specific response that you go to, the next question is it a healthy response? Is it sustainable if you are to respond to stress and difficulty in the same way every day, right? What are the chances that you might have a problem again in the future, right? And a good example is substance use. If I'm always responding to stresses and difficulties by using a substance, smoking, drinking, or any kind of substance, then chances are, if that stressor continues on for long, I might develop dependency and even addiction, right? So in as much as in unhealthy coping strategies almost give us an instant relief, but most of the times they are not sustainable and they are likely to lead to another problem. So our ability to cope with stressors is the first and most important pillar in looking at our mental health and wellness. So it's not the absence of stress, but it's more like how we address a stressor when we meet it, right? So other parts of this is, are we able to work productively? Are we able to realize your potential? Either you are in academia, you are a student, or you're a staff or an employee, or just at your own private engagements. Are you able to work productively? Are you able to do that activity to the fullest of your potential, right? And then the last important pillar is the activity that you do every day. Do you feel like it's making a meaningful contribution? Do you feel like we value it? Do you think it's important? Because when whatever it is that you're doing, it's not, you don't feel like it's adding a meaningful value contribution, then your mental health is likely to be affected, right? Just a minute, kindly. So let's probably continue on. So now that we have understood that mental health and wellness looks at our ability to cope with stressors, being productive, having meaningful contribution, and living up to our potential. So what are the areas that make up mental wellness? And the first pillar, of course, is self-awareness, right? How much do you constantly do a check-in and look into yourself? Because self-awareness will help you understand, this is how I respond to moments of high pressure. These are some of the self-defeating thoughts that I have. These are the moments when I question my competencies and my skills, right? So when we say you start from the place of awareness, from known to unknown, you need to know, first of all, how is it that you respond to various difficulties and stresses that we might meet in everyday life. And then now use that information to now tackle the rest. Because if I am self-aware, I might know that I tend to have an emotional outburst when I'm angry. If I'm self-aware, I will know that during periods of high pressure, like when I have expectations to do, I need to handle students' affairs, I need to sit for an exam, I become overly anxious. So I need to tackle and handle my anxiety before those high pressure moments come. Right? Self-awareness will be able to point out to you very clearly that my work-life balance or my work-life integration is off. I am spending more time on pursuing academia or on occupational growth than I'm actually spending on other personal and social activity. Self-awareness will also maybe point out to the fact that my resilience is too low, right? When I meet a stressor, I'm already defeated. My stress tolerance is extremely low, right? I need to increase my stress tolerance. I need to be more aware of how I respond to stressors, right? Like, for example, if you're joining me to do some introspection, how do you know that you're stressed? What are the pointers of stress for you, right? Because in as much as we might have those ones that are common and cut across, but then how they appear usually tend to be different, right? Some people, when they're stressed, they can't even remember the last meal they had. Others, when they're stressed, keeping them away from food is now the hardest part, because they engage in what we call stress feeding or emotional eating. So their consumption will be high. Other people, when they're stressed, they're unable to initiate sleep. So it's just tossing and turning for hours, right? Other people, sleep is the only thing they want and can't do at that specific moment. So as we are increasing our self-awareness for the overall goal of wellness, are we aware of how we respond differently to other things, right? So those are the pillars of some of the key aspects in mental illness. And then finally, that there is knowing when to seek professional help, improving our health-seeking tendencies and behavior, right? Most people usually come in when it's too late. In fact, they don't even come in, they are brought in because they've had this difficulty for a long time, right? And it's unfortunate because for some conditions, for example, like suicidal thoughts, which is very common, right? Yes, it's a very, very suicide the thoughts and suicidal attempts, very, very common, and it's on the rise in the country. So difficulties to do things like suicidal thoughts and ideation, these are not things that we can wish away. We need to be more proactive in trying to address and get a solution. So these are just a few aspects of mental wellness, right? So from the aspects outlined on your screens, which one would you say you actively try to improve? Do you ever work on your support system, making sure that I have a solid support system? Because a solid support system usually works in this way. Think about this example. Say you're in I'll use a boxing match because that's one of the areas I'm familiar with. So you have a boxing match, right? Then you're in there with this opponent. They might be very big and scary and intimidating, right? So the support system is right there so that when you're down, these are the people who can push you up. They can affirm you. They can give you support. They can give you tips and reassure you that you can be able to actually excel and continue on, right? So a solid support system, it has to offer quality. It's not a matter of how many people you have in a support system, but it's a matter of the quality, how much support are they willing to offer? Because sometimes we're very alert to the fact that we can't be alone in groups, right? You can be alone in a group, which now brings about feelings of loneliness. Yeah. So what are these emerging issues? What are some of the concepts of areas in mental health that would come out or in higher learning institutions that would affect our mental health and wellness, right? The first one, of course, is the pressures, right? Academic pressures to excel. We go for learning institutions, we go into academia so that we increase our competencies, our skills, right? We increase our employabilities, our ability to be productive in other aspects. But this pursuit sometimes can be extremely overwhelming, very exhausting, and can take a toll on our mind, bring about difficulties with anxiety, right? Stressors. Remember, stress, we usually say stress comes when the expectations are more than your capability, right? So I have 2 days and I need to do a 5-day task. I need to accomplish a 5-hour task in 1 hour, then that's already a stressor. When the expectations are higher than your ability, then that is what brings stress. That emotional reaction that comes about when you have a lot to do in a short time, you have a lot of needs to take care of in a limited amount of resources, that is what brings about stress. Right? So with increased workload, either you're juggling between work and school, or even if you're in academia, you're juggling between that and trying to initiate your social life. These are some of the areas, right? And then, of course, we have burnouts, right? Burnout seems like it's one of those phenomena that are reduced to people in the workplace primarily, but it cuts across. Even people in academia will experience some form of burnout. Are we aware of how burnout looks like? What are some of the indicators of burnout? Would you be able to tell that I'm experiencing burnout? I need to take a break. I need to be more intentional with my break times. So I need to re-energize. I need to utilize those breaks and holidays to regroup, right? If you have struggles with identifying burnout, remember I posted on the chat box a link that you can use to do assessments, right? One of the assessments there is the burnout assessment. So as you go through the questionnaire and answer the assessments, are you able to notice any symptoms that you have been feeling, right? Emotional exhaustion, low productivity, things are becoming monotonous and routine. Those are one of the most unique aspects of higher learning that can impact our mental health. Of course, the second one is substance use, right? I invite you all to just look at a report. Remember, NACADA released a report on a 2024 report on the status of drug and substance use in Kenyan universities, right? It's very alarming. right? The scales and the new trends are there. It's a very long report. Maybe we'll have a chance to discuss it, but substance use is a big problem, right? And if you're someone who engages or indulges in a substance, right? I have a very quick assessment that I'd like us to go through. So think about that drug that you use, alcohol, marijuana, prescription tablets, cat, any substance that you use as an individual. I want us to do a cage assessment. I'm going to ask 4 questions, right? It's a very, very basic assessment, but the good thing is you'll be able to give us an eye opener. So I'm going to ask 4 questions. So think about that drug or that substance that you use, either it's occasionally or periodically, or you use it socially, doesn't really matter. So think about that substance. And also remember, it's not just reduced to behavioral or addictions or substance. Sometimes we have addictions of behavior, right? So we have chemical addiction, drugs, marijuana, alcohol, and the rest. Then we have process addiction or behavioral addictions, gambling, right? Betting and gambling, very big challenge in the country, and especially in higher learning. So much so that people are taking their school fees, right? People are taking their upkeep. Then they struggle now to cope after losing such bets. So those are also equally behavioral problems or addictions. So I'm going to ask 4 questions. And from these 4 questions, the answer is either yes or a no. So you answer it within yourself and find out. So the first question, have you thought about cutting down or reducing on your intake, whether alcohol, cigarettes, prescription tablets, any kind of substance that you use, or it could be a habit or a behavior like gambling, right? And betting. Of course, certain conditions that are frowned upon that people don't really talk about, like porn and masturbation, are also equally in there, right? So all those, either it's a substance you're using or a habit. So the first question, have you thought about cutting down or reducing on your intake? Question number 1. Question number 2, do you feel angered or annoyed when people comment about your usage? Oh, nowadays you're using too much or you're using in excess. Do you get angered or annoyed when people comment about your use? The third question, do you feel guilty about your use? The day after, the morning after indulging or after partaking, is there a feeling of guilt that you get afterwards? And then the fourth and last question is an eye-opener. Has it gotten to a place where you have to use a substance or engage in that habit just so that you're calm and you're able now to do everything else? So those are 4 questions. We call it as cage assessments. So if you have a yes or 2 or more yeses, then you need to look deeper into that habit and to ensure that it's not dependency that can lead into addiction. So that's just a basic assessment. But from the link I shared, you can now do a more comprehensive assessment, right? It's called an audit assessment by WHO, which now specifically looks at all the other patterns of substance use within a person. Right. So substance use and addiction is a very, very common thing, right? From the report in NACADA, institutions of higher learning have the highest use of marijuana of anywhere else in the country. Yeah. The highest prevalences. It's not like it's almost socially acceptable in this kind of environment. So maybe those who are in our institutions learning, especially the students at the moment, and can share with us and just tell us, why is it so welcomed in those spaces, right? Because remember, for us to be able to assist, we need to know more. Why is it so welcome? Is it a pressures from school? Is it the pressure to fit in? Is it a need to fit to fulfill our curiosity? Is it that for the first time in a long time, now we have access with less restrictions or monitoring for maybe people in authority or parents and guardians, right? Why is the link to substance use higher in institutions of higher learning? Why are substance use so high in those environments? You can share with me your thoughts maybe on that, right? Another aspect or other emerging issues is loneliness and social isolation, right? Loneliness is becoming a current challenge, especially for young adults in the countries, right? People don't want to initiate relationships or connections, right? Both friendship with peers and even romantic ones. So these feelings of loneliness and isolations actually breed and bring about mental health struggles. Some people in institutions of higher learning, it's the first time they're away from their family and loved ones, right? Especially those who have to go, especially to far away campuses. You're going to new environments, away from your support system, away from your relationships. Then you have difficulties with now initiating or building up new connections. That is one of the biggest challenges in the current world, right? So, and it's so much so that even even issues to do with trust, all of them fall into this bracket of social isolation. Remember, health is in connection, right? Problems love silence. When you isolate, when you withdraw, right, then you're just giving it the fuel for it to continue and progress on and on and on. Those feelings of loneliness and the rest. Right? And now we have difficulties, of course. Now the new dynamics with technology and internet and digital use, right? This is becoming a problem, right? If you could do an inventory, an assessment of your time, an assessment of your 24 hours, right? How much of those time, or how much of those 24 hours have been spent on either digital or the use of technology without necessarily hoping to accomplish a task, right? Right now, we are using our screens, we are online, we are listening to a webinar, we're having a discussion, right? But then maybe this is something that was within your schedule, you had planned for this. But then how much time are you spending on these devices that are actually affecting other things, which can have interruption with our sleep, difficulty with initiating sleep, sleep deprivation. Remember, if you're having sleep deprivation, then chances are you'll be very irritable, because sleep hygiene and mood regulation go hand in hand. If your sleep is off, then definitely your mood and your emotions are also likely to be affected. And this same digital media, right? So what is the difficulty with managing? Is it a form, or is it a fear of missing out? Is it the feeling that when I put my phone on the side, there's definitely something happening somewhere that I need to keep up in tabs? Is it a fear of missing out, right? It could be a very simple phenomenon, but remember, this is a product of anxiety. So one thing that we're not going to do is to pathologize everything that we do, try and give everything to seem like it's a problematic diagnosis. But we do know that when most things are not regulated, they could lead and progress to actual diagnosable mental health conditions. In these same digital spaces are where we find issues we do with harassment, bullying, and the rest, right? The difficulties and compulsion to fit in, to conform to new ways of doing things. These are some of the things that are taking a toll on our mental health in this specific institution, right? So I mentioned a bit, of course, about financial, we mentioned before. The need, rising cost, education is on the rise. Having to juggle, right? How do I go and make something, and then in the same place, how now do I come back again? If I have to go and make school fees, I will miss classes, right? If I attend classes, I might not have enough to actually pay for those classes. The reality of having to juggle all those responsibilities takes a toll. So these are just a few issues that are very prevalent and come out. Maybe the rest now we'll also share as we continue on in our discussion. So having known some of the dynamics, right? And of course, one of the dynamics that is missing there is difficulties, especially harassment and trauma. Remember, university environments or institutions of higher learning, they have very different personalities, very different people coming to this institution. We meet people from all diverse backgrounds, right? It's not uncommon to hear issues to do with harassment. Someone has experienced a traumatic event, got mugged, got attacked, either physical or sexual assault or abuse, and these things all happen. So if you experience a traumatic event, right, and a traumatic event in this case, these are situations, right, or events that caused emotional distress within ourselves, right, and they're constantly, we are preoccupied with the thoughts. It could be something just as a mugging, right? I got attacked, I was mugged from the back, and at the moment I'm having difficulties having anyone behind me. So if I'm going to an exam room and there are people sitting behind me, I am extremely uncomfortable. So it could be just something as simple as that, right? So if you're having difficulties after experiencing any kind of situation, it might not be enough to hit the threshold for post-traumatic stress, but at the end of the day, trauma reactions will still be there. And remember, these are not things that we can wish away. We cannot just hope that one day I'll wake up and I'll forget about the accident I had. I'll forget about the loss that I experienced, right? These are things that we actively have to work on. So how would someone be able to point out or notice that they're having some form of mental health difficulties or mental health struggles? The symptoms cut across, but at the end of the day, with the help of self-awareness, we can be able to pinpoint exactly how our symptoms, right? Because some of the symptoms, just from the ones that are listed, is changes in sleep and appetite. But these changes could take any effect. It could be an excess or it could be a decline, right? Some people sleep for days. Others, they just toss and turn. They spend maybe say an hour in the bed. So poor sleep quality, changes with mood, difficulties managing and regulating emotions. I am having extremes, right? I'm having an emotional outburst. I'm withdrawing for long periods of time. I'm constantly feeling tearful. Right? My mood is constantly low for a long period of time. Social withdrawal, right? Isolation and withdrawal. So remember, I said health is in connections, right? Problems just want you to lock yourself up, remain with one perspective, alienate yourself from other people who can actually be able to offer support. Changes with productivity and functioning. You are sitting there, you've noticed you're unable to absorb and retain any kind of information. You open your notebook, you open your computer, you're staring at it blankly for hours. No work is getting done, right? Difficulties with concentration, memory, even to do this, right? Increased sensitivity, or you are always on edge. Everything is rattling you, right? Everything, or even hypervigilance. You're constantly checking the environment. Is everything safe? Someone says hi, that is viewed as a suspicious kind of behavior, right? Anxiety, apathy, getting to a place where you're emotionally numb. So these are just a few ways, among others, that hopefully we'll also just go through as we go through the course of our discussion. But then for mental health condition, most of us would say that I have mental health, I am healthy, I am doing well because I have never been diagnosed, I have never seen a psychologist, I have never gone to see a psychiatrist, I've never gone to a psychiatric hospital. So it means that I am probably okay. But the lack of a diagnosis does not mean you have mental health, right? Our mental health is constantly changing. And it just doesn't mean that the people who are unwell, who are being brought in for admissions, are the ones who need the support. So we say mental health is a continuum. We're not just sick and healthy. Sometimes we fall in between because the struggles are gradual. The longer you stay without healthy coping strategies, the longer we stay without actually getting the right tools, then our mental health progressively declines over time. So just for maybe the presentation on your screen on there, right? Where would you say your mental health is at the moment? Are you excelling? Are things good? Are you more intentional? Are you happy? Are you fulfilled with your roles, with where you are in academia at the moment? Are you thriving? Are you in survival mode? Just doing the bare minimum to get by, to meet objectives, meet demands, and then I'm moving on. Are you already struggling? Are you having problems with your sleep? Sleep is usually one of the first indicators. Are you having problems with mood regulation? Are you isolating for long? Are you struggling to do things that was just off the top of your hands now? Are you having difficulties with self-perception, self-doubt, doubting your competencies? It is constantly, this is what we call the mental health continuum. As you can see, the visual representation, the bars are constantly reducing, right? So even if you were to use your phone as an example, right? At what point would you notice, oh, now I need to charge this thing up. Now I need to power it up, right? Bring the charge now to 100%. How often do we actually do that for our own wellness? When you notice that now your energy levels, your concentration, your mental health is being affected, how active are you in trying to get it better? As you can see from the presentation on your screen, the symptoms are getting worse progressively, from being fulfilled, energetic, and high-performing, right? Now starting having feelings of anxiety, being worried, having low mood, trouble concentrating, withdrawing, my relationship are no longer fulfilling. I open my notebook and I can't even read a paragraph and absorb. Then constantly, it keeps on declining. Then finally, it hit the crisis. In the crisis mode, only professional help can assist at that point. Most of the time, it will require admission or any other complicated aspects in life. So why is your mental health just by looking at the continuum? Are you happy with the bars that you have? What steps are you taking to actually improve your wellness and get your mental health continuum and yourself to move up and up? So our mental health continuum is just a diagrammatic representation of how our mental health and wellness slowly progresses over the period of our period of time. Yeah. So maybe so I'll move on. So we have a lot of mental health conditions, right, and a lot of mental health diagnoses. Over 300 of them in the diagnosis and statistical manual. Okay, so you can also share with us maybe there, if you're comfortable, where do you think your mental health is at the moment? struggling. If you don't want to share, just do some introspection. What do you think might help you get out of that current situation? Is it professional assistance? Is it being more active with your self-care? Is it taking a break? Is it learning to say no? Sometimes a tool as simple as being assertive, learning to say no, is actually what you might just need for your mental health and wellness. I am doing a lot more than I can. I am taking on a lot of expectations than what I can meet, which is now making me now to be anxious, to feel stressed. So it's a cycle. So that's it. So like I mentioned, we have a lot of mental health conditions, a lot, more than 350. But which ones are the most common, and especially in institutions of higher learning, that could be the highest prevalence for both students in academia and even the staff in those institutions, right? So some of the most common mental health conditions here, first one is anxiety. Anxiety disorders are very common. 1 in 4 people struggle with an anxiety disorder, right? I can see here from looking at the participants, we are 29 in here. So if you are having a physical virtual discussion or a physical in-person discussion, then to assess for anxiety is so easy. You don't even need to say aloud. Just say, just tell us your name, introduce yourself. At the moment I start counting, it's 3 people, then me, it's 2 people. I'm next. What's my name? That sense of dread, that sense of panic, that is what anxiety is, or what we share an anxiety disorder is. So anxiety is normal. Everyone needs anxiety. Anxiety is what makes you, okay, tomorrow I have an interview. I have to go through the company website. I have to look at everything and make sure it's ready. Tomorrow I have a big presentation. Tomorrow I have a class project to present. I have to make sure that I do things well and accurately. So that is what anxiety sometimes makes us to take more caution. But these same indicators for being alert can progress to an anxiety disorder, right? Anxiety disorders are extremely uncomfortable because they come with physical symptoms: sweating, trembling, shaking, palpitation, increased heartbeat, stomach or gut problems, which we call butterflies, and the rest. So what is it that induces anxiety within yourself? What causes you to be anxious? There's always an element, right? Some of us have perfected the art of avoidance, so you will never be able to, they'll never be around the anxiety in these situations. But what causes anxiety within yourself, right? Is it social situations? If you are to tell you to stand in front of the class, give a presentation, present an idea, is that what causes you anxiety? Other people are anxious around people of authority, right? You're in the classroom or you're in the staff area, you've been told the boss, the manager needs you. You start panicking, you start dreading, right? Others have what we call phobias. There's no way I'm going up that building. I am not using the bridge. I am not using a water body, right? I am not using the elevators or the lift. I have to stay on the ground floor. I am not getting an injection. So those are specific phobias that also happen. But for anxiety, the main thing that I could share is exposure. Expose yourself to that thing that makes you anxious. In a small way, we say it's graded exposure. Start from small, going up. Because when you expose yourself, you will find out how you actually able to do. You can restructure the thoughts that you had. If this environment was rather scary and concerning, now it might feel less threatening, right? The next one, very common condition, is depression, right? So how do we describe depression in a clinical context? The first thing is low mood and sadness. You have had low mood and you're sad, right? Do we know how sadness looks like? Are we able to say or pick up moments when you're sad, right? Most people, especially adults, struggle with emotions. Children, on the other hand, are very, very alert. They're able to pinpoint how they're feeling. This has made me sad. I'm angry. They will pinpoint. But for adults, most of the time, we summarize how we are feeling into 2 things: stress and I'm feeling funny. So what is this funny feeling that we always find? One thing we know is there's nothing humorous about it. It is not funny at all. So this funny feeling, is it sadness? Is it anger? Is it disappointment? Is it agitation? This funny, are you able to pinpoint exactly what this funny feeling is, right? Because if it's sadness, do we know how sadness looks like? Are we able to point out? Because we could have these difficulties for a long time, but we're not able to even identify that this is actually what I might be battling with at this specific time and period. So depression is low mood and sadness for more than 2 weeks, together with what we refer to as anhedonia, loss of interest. You're looking back, nothing is interesting you anymore. All your hobbies just look bothersome. You don't want to do anything. You want to do less and less. Then another symptom is constantly feeling fatigued. You're always lethargic. You're sleeping 6 hours, waking up more tired than before you went to bed. Then now coupled up, those are the 3 primary symptoms. Then you can add other things like a pessimistic view, suicidal thoughts, and ideation, right? Which is now one of the risk factors in depression that can lead to loss of life or death by suicide. So depression also very fairly common. If you maybe want to do an assessment, I invite you to use the link. Find out, am I able to put words into what I'm feeling, right? So stress and burnout, I mentioned that before. Stress comes about when the expectations are more than our capability, right? That deficit in between, right? That emotional reaction that comes when they have a lot to do with limited resources, that is what stress is. For substance use, also very common. Remember, we gave I shared an assessment, a very brief assessment to look at our substance use. If you are struggling with a substance, be it a drug, alcohol, or anything else, be it a behavioral addiction like gambling, right? Others that people want to mention, like porn and masturbation, equally a problematic behavior. Seek support, right? Don't let that challenge or that problem alienate you from what you actually should be able to do and accomplish. Then you have difficulties with trauma. Again, on that assessment, you can look at it and assess for post-traumatic stress. If you've experienced a traumatic event, you know that it affected you. It made you experience some form of emotional distress. You're constantly having thoughts around it. You now have made adjustments to your life as a response to the event that you experienced. That is likely to be a traumatic symptom. It might not be enough to have a diagnosis of PTSD, but it will still affect your life and the quality, right, of how you go about your things. Then we have difficulties like attention deficit hyperactive disorder, ADHD, very common actually also in the country at the moment. A lot of young people, young adults are struggling with this thing, right? And if you're in an academic setup, you are pursuing higher education and you're having difficulties with ADHD, you might have struggles, right? Going through classes, accomplishing, finishing your courses, going to the next time, right? You might constantly be in a position where you're starting off things, putting them on, starting off things, putting them off. So if you've noticed that pattern within yourself, if it now seems like it's just more than just procrastination, it now seems like it's just more than loss of motivation, it's very important for you to do some checking, right? I would never recommend a self-diagnosis, right? But you can also, I'll maybe also share, where do we get these professionals from, right? Where do I get a psychologist? Where do I get a mental health practitioner who can actually be able to assist me, right? And if you're in, for example, in an academic institution and you do know that there are counselors present at your institution, you can also share on the chat box so that students and people who are pursuing academia in your institution can know that the counseling department actually works. And if there's a counseling department in the university, have you ever even been curious enough to step in and just find out, so let me go and have a chat with the school counselor. Let me go and have a chat with that practitioner who always sits in that office. Let me ask them this and that. Let them shed some light, right? Remember what we said, health is in connection. If you alienate yourself with your own perspective, then chances are the difficulty will progress even more, right? So those are just some of the most common, at least. And then, of course, we spoke about sleep, right? If you struggle with sleep, you go to bed, you toss and turn. You fall asleep, but you wake up in the middle of the night, involuntarily, unable to go back to sleep. You're sleeping, but waking up more tired. You're trying to get some rest, but you can almost hear yourself. You can hear your mind very loud and engaging. I would recommend you to look at something we call sleep hygiene. Just go on the internet and just look up sleep hygiene. Sleep hygiene are natural ways for you to improve your sleep quality. Remember, sleep is one of the only few ways where our mind can actually be able to relax so that we can actually be able not to tackle everything else that come about. So if you struggle with sleep, look up what we call sleep hygiene. They're just simple self-help tools, right? They don't require a practitioner like myself. They don't require medication, but they require something a bit more difficult than all the rest. It needs behavior change. For you to improve your sleep, you have to engage in behavior change. You have to change your relationship with the bed. You have to change how you prepare for sleep. You have to change your sleeping quality and your sleeping pattern. behavior change is very difficult most of the time because it cannot be induced by any kind of medication. It requires a willingness to do things differently, to do things in a better way. And with that lack of motivation, sometimes we never really get the kind of assistance that we need. So how is your sleep? How many hours are you sleeping? Right? How many hours should you sleep? The recommended hours is between 6 to 8 hours. But then how many hours are you sleeping? Is it 4? Is it 3? Right? Are you maybe one of the people who believes that we will get time to sleep, right? At the moment, it's time to do other kind of engagement. So I would recommend look at sleep hygiene. Very, very, very important. If you're sacrificing your sleep for academic success, I assure you that it is possible for you to excel and still take care of yourself. These two things don't have to be at war with each other. It is possible to pursue your wellness and well-being and still excel at the things that you do. If you expect 100 from yourself, why would you give yourself 40 or 50, right? So the more you expect from yourself, the more you should actually be able to give yourself. I expect myself to sit and study or work for 8 hours continuously. Okay. Then I know very well that that's not going to be possible if I don't sleep. That will not be possible if I don't eat what my body needs. That will not be possible if I am not constantly having some form of physical activity. That will not be possible if I'm not aware of when I'm overwhelmed, if I'm not aware of when I'm experiencing burnout and other phenomenal aspects around that. Right. So these are just mentioned some of the common mental health conditions. So maybe just a minute, let me check the chat box. I'm seeing a couple of questions. Maybe I'll just address maybe one or two. So there's an Steven mentioning, could masturbation offer a safer way of achieving sexual pleasure? At what point is it? At what point will it be a problem? Aha, a very good question. So, could masturbation be a safer way of experiencing sexual pleasure without actually all the other risks, like risk of infection, risk of pregnancy, and the rest? And at what point is it a problem? Right. So a very good question. So remember, porn and masturbation are behavioral problems, right? But at the moment, they are not been included in the manual for mental health as diagnoses. Porn and masturbation is still not added as a diagnosis, but they're there as behavioral problems that could result as time goes by. So at what point is a behavior like porn and masturbation a challenge? One, look at it as any other form of addiction. The first thing is there will always be an element of tolerance, right? So the question here was asking primarily about masturbation, but most of the time they're paired together, right? Pornography and masturbation. So what are some of the aspects of addiction? The first one is tolerance. Using more, indulging in more to have the same kind of feeling, right? So this would mean like, and will allow me to just go through it because no other space will people talk about porn and masturbation. So obviously, despite it being a problem, right? So how will you know that you're having tolerance? How much time are you spending on those sites? That's the first indicator, right? Maybe at the beginning you just go, but at the moment you're seeking deeper and deeper, right? Spending more time looking for the kind of material that you need and require. So that is tolerance. Spending more time to try and get what actually we might fit, right? Another one is withdrawals. Are we aware that even behaviors like porn, masturbation, will have withdrawals? The withdrawals, of course, will not be as classic as alcohol, the shakes and the tremors, but the withdrawals here will be a bit more subtle, but still very uncomfortable. Irritability, very possible. Anxiety, almost 100% guaranteed. Remember, the body has been used to getting some dopamine rush. And then at the moment, it's not getting that anymore. So what will happen? You will be constantly, you will have this feeling like something is missing. Something is missing from my body. There's something that I'm not getting, right? What is this that is lacking? It's probably the habit that you are used to. So with porn and masturbation and all other behavioral addictions, you will have tolerance. They need to do more to think deeper, develop very unique, and spend a lot of time on those websites and that habit. Then withdrawals on a day that you say, okay, I don't need to do this anymore. There'll be some form of discomfort. You might find yourself irritable, being anxious, difficult even initiating sleep. depending on what you pegged that behavior with. If you used to engage in porn and masturbation just before your bedtime, then you realize the same way as someone who smokes before bedtime, you will have a difficulty initiating sleep. So the problem is not stopping. The problem is remaining stopped, right? And there's always, especially for young people who've not gone into relationship or marriage, there's always the thought that when I get a partner, the behavior will be gone. But that's not really the case. Remember, we are conditioning ourselves, right? And by the time now you're having a partner, your perception of sexual intimacy has been skewed. It's different now. It has been affected, right? So you realize that it doesn't have the same kind of fulfillment. We might even have these things like performance anxiety because our expectations of sexual intimacies are different from what should actually be happening, right? Other problem is it changes our perception of, like I mentioned, of sexual intimacy. We have extreme expectations from other people that will not be met, yes, and will not be satisfied, right? So it's not really a matter, it's not one of those challenges that you want to hope to solve when you have a partner, because these are habits that can be had in relationships with partners, and they can be lifelong, right? And remember, excessive indulgence in this can bring about complications like PE, erectile dysfunction, sorry, premature ejaculations, erectile dysfunction. So there are a lot of consequences that can come about with that specific one. So maybe if you can ask another question for clarification on that. Is asking, kindly expound on prescription drugs and how it causes addiction. All right. So prescription drugs are medication that you are given by a doctor. Like you can come in, our psychiatrist might prescribe, you can go in for a physician, they will be able to prescribe. These are actually medication that you can buy from a pharmacy. But remember, the fact that they are prescription drugs doesn't mean that you only access them having prescriptions, right? We do know that sometimes you can have access to these medications even without a prescription. So how will it cause an addiction? Let me give an example of sleep medication, because that's one of the areas that I specialize in here. So you come in with a sleep problem, right? Then we assess, you do assessment, maybe the psychiatrist might prescribe sleep medication, right? Any kind of sleep medication, Cilox, any medication you might be prescribed for. But because us as practitioners are aware that sleep medication can lead to dependency very fast. You can imagine a tablet that you swallow and you sleep like a baby, right? You might want to take this every other day continuously. So we know that prescription medication or sleep medication might lead to dependency. So we only gave you that medication for 2 weeks. So we give you a prescription for 2 weeks, knowing very well that you need it. So you go to the pharmacy, you give a prescription, you're given 2 weeks, as the doctor said. Then you go and take this medication for 2 weeks, you're told to come back for a review afterwards. Then after taking this medication for 2 weeks, you realize that I'm actually sleeping very well on these meds. So well, like, do I really need to go back to the doctor? Really? I just need my medication. Then because we are very resourceful, you find a pharmacy that is able to fill that prescription without a doctor's note. So what happens? A prescription that was supposed to last for 2 weeks is now only 6 months, right? We were giving that prescription to 2 weeks. Somehow, it's 3 months, 6 months down the line, we are still taking that medication. So how will this cause addiction? It will lead to dependency, right? Remember, you are giving medication on a specific timeline because we know that that timeline is what the body needs to restart. And then from there on, now we can engage in other activities or interventions that do not need medication. So if you use a prescription for longer, or you use it for a way that it was not intended, it might lead to addiction. So that's one of the ways in which prescription tablets or prescription drugs can lead to medication. The one that you're given by a doctor, then you use it differently from the prescription, or some never even come in for the prescription in the first place. You just self-diagnose, and we Google, and then you realize, oh, I had a friend who had this problem, they took this medication, I'm also now taking it, right? And maybe for a more clear contextual example is the opioid epidemic in the United States, right? Or in North America. The opioid epidemic was made worse by prescription medication. People who are put on medication for pain, right? Especially people with chronic pain who need medication for a long time. You start taking those medications, then you realize that somehow you start getting hooked. Maybe the prescription is now expensive. Then you realize there's a cheaper version that might still offer the same benefit because at the end of the day, it's still an opioid. Then now we shift that drug. And before you know it, we are deep into prescription drugs. So think about it. That medication that you're taking at night, in the morning, at lunch break, who prescribed it for you? And whoever prescribed it, did they prescribe it to last that long? Are we filling our prescription on our own, right? Because most of the time, remember, doctors give medication with clear instructions because they're aware of some of the effects, things like dependency and even outright addiction. So yes, prescription medication have the capacity to cause addictions, and sometimes it can be very, very difficult. Remember, treating addictions are very difficult. Once you have an addiction, there's no cure for addictions, first of all. You cannot heal from addictions. We are always in recovery, right? So that's what it means when someone has an actual diagnosis. So I'll just tackle those two questions for now. I'll answer the rest. If you have a question, just drop it on the chat box so that I can continue on with the presentation. I know we are almost there. So think about, so now that we've seen these conditions, right, that are very common, we've looked at some of the aspects of the dynamics available in this institution of higher learning that can lead to mental health difficulties and struggles. So what are the barriers, right? If you as an individual, this is now where we have to now look at each one of us as a person. If you as an individual had a difficulty with your mental health, you've noticed, just from the symptoms I was sharing before, I am not sleeping well, I'm constantly sad and feeling low, I'm having suicidal thoughts. Ever since I experienced that kind of traumatic event, nowadays I'm unable to sit still. I am very anxious. I am missing class because I cannot stand in front of my classmates. I am missing work because I'm so anxious I can't stand in front of students and deliver. What would prevent you from coming in for help at that point? If you've noticed that your mental health continuum, you've moved from thriving to surviving to struggling, and you're still not getting help, what could be the cause? What would it take for you to walk into a mental health institution, to walk to a mental health practitioner and just tell them, Daktari, or my counselor, or my psychologist, I'm experiencing ABC. What would it take for you? Would we even show up, or would we find ourselves there? Because remember, sometimes when you're too overwhelmed, we are brought in by our loved ones, right? What would it take for you to go in and see a mental health practitioner? Right? So what are these barriers? Of course, the first one is stigma. The stigma for mental health is a lot, and the stigma cuts across. The illnesses are stigmatized. The people who are suffering with these conditions are stigmatized. The nature of help is stigmatized. Even the practitioners sometimes experience some kind of stigma based on the field of work, right? So stigma, the fear of discrimination, right? If I was to walk back to the institution, if I was to give my lecturer, give my trainer a note that, if I was to give a note to the school that every week on Wednesday from 10 to 11, I will be going to Hospital to see my psychologist or to see a mental health practitioner. How possible is that to happen? Would you ever share such information? And the opposite is also true. If someone was to share with you that they have a mental health condition, or have been feeling unwell, I went to a hospital, I went to Chiromo Hospital, I was diagnosed with anxiety disorder, I was diagnosed with alcohol use disorder, I was diagnosed, or I was told I have attention deficit hyperactive disorder. If someone was to share with you that they have a mental health diagnosis, how would you treat these people? How would you behave around them? It's not uncommon for us to start fishing for symptoms. Someone shares that they were diagnosed with bipolar illness. So when they're quiet, everything now all of a sudden about them is a symptom. Remember, these are conditions. These are illnesses. They're not a personality trait, right? Those are very different, right? They're not personality traits. There's still a human being in there who just has a difficulty. When someone has malaria, we don't say that this person now is malaria. This is a condition that they have, that they will be treated for or managed, and then they can continue on with their life. So let us, we talk about societal stigma and everything, the society, but we are the society, myself and the 39 others who are joining me, or 32 others who are joining me are the society, right? If I choose to end stigmatizing people with mental illness, then that's one less person. If the other 32 people who are joining me today also choose to end discrimination and stigmatizing people who are illness, then those are 33 people less, right? So we are the society, right? Rather than just labeling things and hoping that all of a sudden it will fix. If you ask for the society, there's no one single person who can sit here and claim they are. It's a collection of people. So if it's an individual responsibility, for example, to use more inclusive languages, to avoid things that could be stigmatizing, to avoid describing everyday activities or phenomena with mental health conditions. Oh, it's rained, then the sun came out, then it's raining again, the weather today is bipolar. Those are things that actually happen out there. So when I hear you describing the weather as bipolar, and I have a diagnosis of the same, right? Then what are the chances that I might share your struggles with you? I might give you insights. So let's use very inclusive language and be very, very mindful of people with mental health struggles, right? So that's the first barrier. If I know that people will talk about that I went to this kind of hospital, I will not even go for treatment because I don't want to be associated with that kind of thing, right? Other barriers is lack of awareness. Remember, I asked, are you as an individual able to tell when you're struggling? Can you be able to pinpoint that, oh, now I need to do something. I am not sleeping. I am not concentrating. I can't even sit for an exam. I can't do my work. Will you be able to, are you aware, right? Students may not know in some of these institutions. We are on autopilot. We know things that should be done and we will get them done despite how we are feeling. So sometimes it's lack of awareness. Other times it's help-seeking behavior. Remember, I asked, if you started experiencing some of these symptoms of mental health struggles that we mentioned, like withdrawal, slow mood, anxiety, being apathetic, at what point will you seek for help? That is what we refer to help-seeking behavior, right? What would it take for you to come in for assistance? Even if not for proportional, but to any kind of support, what would it take, right? Sometimes we come in when it's, I don't want to say too late, but we come in when now things have gotten worse. Then we need our help and care needs to be more extensive and sometimes even more expensive and intense. So something that could be handled by a couple of psychotherapy sessions now needs an admission. Now is a lifelong problem. It was a stressor that was managed through drinking. Then I developed an addiction. And you know what? Addictions are lifelong, right? Yeah, I constantly have to maintain my sobriety to get better. So in your attempt to cope with that difficulties, you could actually be buying time for getting actual practical assistance, right? So help seeking, stigma, of course, is there. Lack of awareness. Most of us don't even know what mental illness looks like. We are just doing what is necessary to the point where we don't even know where access is. Where can you find a psychologist? Who are even psychologists? Where do people find a psychiatrist? What do they even do? Right? It almost feels like this is a problem that I need to rise above. And that's where the most of our challenges usually come from. And of course, remember, limited resources. So I'm hoping if you are joining me on this talk, you know some resources available to you in campus. Just share with the team, right? Just write on there that there's a counseling center in this department, in this building, so that people know this information, right? Like, for example, I would just expect any psychologist. That's why I started saying, we're psychologists, we practice at Chiromo Hospital. Chiromo Hospital is in Nairobi, Mombasa, and I'll also share contacts so that we have actual information for these people, right? I could know I need a psychologist, but where do I find them? Which hospital do I go? I'm in this place. I've never heard of such a thing. So that if you have maybe say, some resources within your academic institutions that are helpful, share them in the chat box so that other people also can be more proactive with their healthcare. So now that we know these barriers, how do we now overcome them, right? Of course, the first one is to tackle stigma. We have to address the stigma that comes with mental illnesses. And I already said that if we are the community, myself and the 30 others, who just make and decide to end the stigma that we could bring, then this could have a ripple effect. Just from having this conversation, I am constantly trying to use in language that is very inclusive, language that does not promote stigma, language that is empathetic, so that people can also be able to reach out, right? And I encourage all of us to equally try the same, right? So that people can now reach out for assistance. We cannot wish away most of these difficulties, right? So fighting that stigma, being proactive, right? So a platform like this, hopefully, maybe we have shared one or two insights that can add on to what we already knew. Remember, as I'm giving these conversations, I am aware that we're not a blank slate. No, we're already taking care of ourselves. So the goal is just to add or to tweak it a bit so that we take care of ourselves even more. And so be very proactive. We learn about all aspects of ourselves. You learn how to use the device that you're following this conversation from. You learn how to do your work. You learn how to not go to class, how to read and write. We were constantly preparing ourselves for all these things. But stress is inevitable. Stresses are very inevitable. So if we know that we are going to meet stresses, we knew very well that we are going to have to go into the workplace. So we went to school, learned skills to survive or to be productive in the workplace. With the same breath, we know that stresses are inevitable. Difficulties will definitely come. How are we preparing for that, right? So wellness and mental health are just things that we're just hoping that we could just run into them automatically. We don't feel like we can equally also actively try. Learn your stress management, learn how to cope. How would I build my resilience, right? Whenever I meet a difficulty, I break down completely. And this breakdown eats onto the time that I need to respond. So the problem becomes worse. I need to learn better coping. The same way you want to learn about ABCD, a skill, a trait, a technique, you can also equally use that same kind of intention to learn about wellness. Oh, I'm in a high pressure environment. Be very intentional about learning how to cope with it, right? Yeah, learn about this. Go to a professional. You don't have to be unwell. Go in to assess, fine tune some of your responses and how you cope, right? Leverage technology. This same technology that could be a menace, that could be problematic, is the same avenue that you're using to deliver this conversation. It's the same avenue that you're using to spread awareness, right? At the moment, there are a lot of things. There are apps that are self-monitored, self-paced. There are those that also have other people. There's virtual sessions like this. Do you know that you can also equally have a session with a psychologist, just like this? If you already have a time strain, you don't have to come in physically. You can equally have access to all those things, right? So there are a couple of interventions for the challenges that we face, but for us to be able to action them, we need to be more proactive, right? Yeah. So I mentioned before I mentioned what we can do as individuals to foster our wellness, right? What can institutions do? Expand mental health services, and if they're there, most of us are unaware. When I was in uni, I didn't even know where the counseling department was. I was struggling. I didn't know. I didn't have any specific problem, but I didn't know where it was. So I'm wondering what happened to the other students who might had a difficulty and wanted to go in. What could they have done? Some of us were lucky enough as psychology students. Some of our lecturers had access, were practitioners, had access to this information. They could do quick referral. They could recommend a few things. But at the back of my mind, I was always wondering, what happened to the rest of school? Over 5,000 students. They don't have access to this lecturer. How are they coping with themselves, right? Yeah. So promoting self-care, right? Self-care is a very, very important tool. It's a protective factor. When you constantly take care of yourself, then you'll be more intentional towards things that are likely to drag you behind, right? So let us set up these institutions, let us have resources, and then these resources also have to be put out there so that people know. So I am choosing not to go in because I have a reluctancy, not because it's not available to me, right? So if you have those resources, also share on the chat box so that people could know, where do I go to, right? If I'm unwell and it's in the middle of the night, I'm unwell, my support system is not around. Do you know that Chiromo Hospital has a toll-free number that you can call? Get psychological first aid, get someone assist you on the spot, then you can take care of the rest later. Are we aware that there are other programs like Befriend Us Kenya? That's specifically a hotline for people who are having suicidal ideation. When you're overwhelmed and you feel alone and you're having doubts, right? There are entire institutions that are specifically just geared towards giving us that support. So we need to equip ourselves with this information so that we can actually do what is necessary. But now as an individual, how do we foster this mental health that we keep talking about? What do we do? Some of the interventions I've already mentioned up there, right? But first of all, is self-care. These take care of the body that houses the mind, right? It has to be, because this mind is in a place, we cannot see it, we cannot touch it, but we know it's housed in this body. So take care of that body that houses that mind so that we know you are able to be more proactive and be in a place where you can actually respond, right? Support system, I said, when you're brought down, when to eliminate those feelings of isolations, withdrawal. Some of us don't isolate because it's a first priority. Some of us isolate and withdraw because our support system is not really working, right? You are having difficulty with issues of trust. So manage stress effectively. One of the pillars for mental health is how you cope with stress. And I invited us to introspect. What do you think about how you cope with stress? Is it healthy? Is it sustainable? If you are to keep doing that thing every day you experience stress, what are the likelihood that you might actually have a whole problem altogether, right? So a supportive environment, of course, also still goes with the support system, but constantly, right? Be in a place where you can respond to the happenings around you, right? Seek work-life balance. As much as work, school, academia requires all this attention, remember, you cannot pour from an empty cup. I mentioned before that if you expect 100 from yourself, there's no way you're going to give yourself 50. If you expect to work for 8 hours, study for 10 hours straight, do you know that you are the person who needs the most sleep? If you want to push yourself the hardest, do you know that you should be the one who's prioritizing self-care the most? So the more you require from yourself, the more you should actually be able to take care of yourself, so that those two things are in line with each other, right? So allow me now to go to, I spoke about self-awareness. Allow me to go to the last slide and then invite other questions. So the last slide here, or the last part of my presentation, is talking about when to get professional help. I have to start off by acknowledging that not everyone requires professional assistance. Not everyone needs to go to a psychologist, to a psychiatrist, to a mental health practitioner. Some of us already have those tools, like a good support system. We are very active and we are always engaged. We are always trying to find out what works best for us, and that's it. But at what point now we know that now this is now getting out of hand? Now I need to go to a professional to get different insights so that I can get and sustain my wellness. The first thing is, if that difficulty persists, I have tried everything, it's not getting better. I am still anxious, I'm still sad, still having feelings of hopelessness, then that's a good time to get professional assistance, right? Another one is if you're going through transitions. There are certain changes in your life that have happened, right? I've just joined uni, I've joined campus, I'm away from family, I'm away from home. I've never been away from home forever. I've never been this far from home. I'm having separation anxiety. I'm having difficulty with coping. I have trust issues. I don't know how to initiate and build new relationships. So those kind of changes require some different perspective from professional to help us cope. If you've experienced trauma, right? That experience I had that night, that day, right? I'm having difficulty coping with it. Get professional assistance. Physical pain, somatic symptoms. If you're having physical pain, physical symptoms that are unexplained, constant gut and stomach problems, persistent, recurrent, unexplained headaches, low back pain, you're looking at, you have back pain, you're looking at yourself, you're looking at your age, you've not pulled your back, you've not had any kind of accident. Why is this pain constantly progressing on, right? Remember, some mental health conditions, when you've had them for a long time, they now progress onto physical discomfort. So that painkiller that you're taking every day for that headache, you might actually be treating something that is not there. So move from those, from apart from just addressing the physical symptoms, also do a psychological check, do a wellness check within yourself. Where my stress levels at? It is not uncommon for someone to go to a physician or a general doctor or an able, and then You hear the doctor telling you, I want to send you to a psychologist. Then you're asking yourself, what have they seen? It's because they have an idea that whatever physical symptoms you're feeling could just be coming about through the cause of a psychological state of mind, right? And then the lastly is for personal growth. Not everyone who comes to see mental health practitioners have a mental health condition, have a mental health challenge. Those are some of the things that are perpetuating the stigma that we have. Other people just come in for wellness sessions. I'm thriving, I'm excelling. I want to know how to keep it that way. Everything is working out well. How do I maintain this good patch that I'm on? How do I make sure that when I meet a problem, I can still be able to excel? Because we ask ourselves, are you thriving because things are good? Or are you thriving because you know what to do in the event of a difficulty? Right. So that's the end of my presentations. If you have a question, please, you are free to ask. Let me go through the questions that have been asked on the chat box that I had not addressed before. For any question, you can just raise your hand, ask, but let me tackle the questions that are on the chat box. So, Stephen, no, I don't know if a question or comment, but Stephen says marijuana is easily available in small, affordable quantity, also perceived as a recreational drug. Okay, so I think this was a response to when I asked that, why is marijuana so accessible and so highly used and the prevalence is so high in academic institution? Of course, the small quantity so makes it more affordable. Even if you have a small amount, you can still be able to get it, and then it's perceived as recreational, right? It's not a problem. It's just something that you're doing for today. But we do know that excessive marijuana use, right, can lead to mental health challenges, right? Can induce psychosis, will lead to anxiety, especially during the withdrawals, right? Yeah. Any other question for me here? Stephen was saying substance use or substance abuse is part of higher learning culture. How do we navigate safely around the culture without being left out or feeling lonely? Aha. So if substance use is part of the culture, right? And you see what we say is when you go to Rome, you do what the Romans do. So this could bring about feelings of being the odd one out. In as much as we might say that this is the best decision, but we don't know. We have to be very, very robust and very practical, right? Sometimes we want to be part of the team, part of the group, especially when you're away from your support system, right? So this is now where we need to identify, to develop a sense of self, right? Identifying and developing a sense of self, knowing that you can equally do things in your own way, how you see fit, and you don't have to fit in what each and every one of us do. And when you have this overwhelming feeling to fit in, right, you even breach your values and your beliefs to fit in, then you already know that's a problem, right? What's happening? Why are you having a difficulty embracing your sense of self, and embracing your ideologies and your way of doing things? We have to acknowledge that we will not always have the same reactions, the same personality, the same traits. But when you feel the need to conform to other people's ways, then that is the beginning of a problem. So sit down, I reflect on your self-awareness, embrace your sense of self, right? Because, and knowing full well that your authentic self can actually attract people, right? You don't need to conform as a way of fitting in. Your authentic self will attract even more people and more meaningful and genuine and conversations. Right. All right. So Stephen was saying, receiving mental health information is what he is doing about his mental health. So this is the starting point. So, all right. Thank you for that. So that's the end of my presentation. I will stop sharing this screen, hand the meeting back to Madam Veronica, and then get any questions that the team might have for me. Thank you for your time.
Thank you so much, Brian. Let's appreciate Brian online, those who are here in the. Thank you so much. That was so good, a wonderful presentation. Yeah, and we want to thank you for that. Yeah, asante sana. So if there is no any other pressing question, I'm seeing I don't know whether the dean is still around. I think she has left the meeting. She was going for another meeting. So I want to take this opportunity to really thank you, Brian and the team, and Jedida, pass our regards. I want also to take this opportunity to thank Dr. Frank Jenga of Chiromo for the good work that you're doing there, and also for the cooperation that we have with the cooperative university. We don't take it for granted. We are really, really appreciating, and so far we've been working on very well. And thank you also members for joining, and also students for joining. And as you've heard what Brian has said, we have the counseling department, which is located at the Dean of Student Office. We have counselors there who are ready to support you in each and every way you want to be supported. I also want to remind students and staff that the medical camp is still on, and we have several services screening. And also tomorrow at this time, we'll be having another talk on addictive behaviors in higher education and impact on students and staff, and it will be offered by the Retreat Rehabilitation Center. So I'll wish students and staff to encourage other members to join tomorrow. We'll be starting at 10 to 11:30 so that you can be able to get this information, because I believe the information is going to help either you or a family member or even a friend. So I want to take this opportunity to really thank you, Brian, and we'll keep on engaging. And our regards to the people that I've mentioned, and we are grateful. We are very grateful, and we are most humbled by the presentation today. So at this juncture, I want to invite, I don't know whether June is still in the meeting, to take us through the closing prayer. Thank you so much.
Okay. And before we pray, there's a question I wanted to ask the person who presented.
Okay, June, go ahead.
My question was, actually I've put it on the chat, but I can ask it. My question was, if you recognize or if you discover that prescription drugs are addictive, are there other ways of, are there other solutions or other options of coping apart from medication?
Thank you for that question. Okay, from your question, you ask if prescription drugs can cause addiction. What are the other options apart from medications? Are there other ways to cope? Yes, so prescription drugs, some of them, of course, have the ability to cause dependency and lead to addiction. But like I mentioned, one of the ways that we go about it is if you take this medication as part the prescription, right, and the recommendation of the doctors, then of course we never have to worry about issues to do with dependency and addiction. So let us just follow the prescription as it is, and then remember, when you're getting medication from a doctor, and from this case I'll talk about especially mental health practitioners, that medication is usually coupled up with other interventions. These interventions now are things to do with behavioral interventions or other ways of coping, so that these two things can work together. Remember, if you pair medication and other behavioral ways of coping, then chances are you'll not need medication for a very long time, and even the doses that you'll have will not be as extensive. So one of the ways of presenting that is following prescription as said, and then constantly also asking and customizing what are the best way of cope. Because if you merge those two things together, then you will need less medication, and chances of dependency and addictions becomes also extremely less. Thank you for the question.
Okay. Thank you.
Thank you, Brian. June?
Okay, let's pray. Dear Heavenly Father, Lord, we come before you. We just want to thank you, God, for this session that we've had. Lord, even as we continue with the other activities that we are supposed to do at work and also in school for the students also, I'm praying, oh God, that you be with us, that you take care of us, and you you help us have a productive day. For it's in Jesus' name I pray. Amen.
Thank you so much. And the students who are here, before you leave, you're also reminded that we are inviting you for peer counseling training, which is coming up next week. Kindly encourage first years and second years to send their application to the Dean of Students through my office. Thank you so much. May God bless you and have a blessed day. Asanteni sana.
Thank you.